My bill is the Psilocybin-Assisted Psychotherapy Act, and under my bill, it will legalize therapeutic use of psilocybin, and it will decriminalize personal possession of psilocybin. So there has been about 60 years of studies that have proven that psilocybin-induced therapy is incredibly effective for those that are suffering with chronic depression, substance abuse, and smoking cessation. A Johns Hopkins study proved that 58% of patients that have been previously using antidepressants to relieve their symptoms noticed an increase even 6 months after the therapy. It is also proven that psilocybin is non-habit forming and is actually does not perpetuate criminal activity like we once thought it did. The Brown Medical Center says that 60% of participants that use psilocybin actually reported a 24% decrease of criminal activity. So therefore, there is no reason that it should be criminalized if there is no reason that criminal activity would come about by the use of it. I'm open to any questions. Bryce, sorry.
I may just be completely uninformed, but can you please just explain a little bit what psilocybin is and what some of the potential risks or consequences are?
Okay, yeah. Psilocybin, its street drug is named shrooms, mushrooms. It comes from a mushroom, and there are little to no risks. There are only 0.2% of users of psilocybin actually had to have medical assistance, and there are no recorded cases of death of mortality, and it's non-habit forming, so there's no way you can get addicted to it.
Representative, please.
I just want to ask for some clarification. So, your bill specifically stated that it would legalize possession of psilocybin, and it would also legalize therapeutic usage. What about recreational usage?
It would decriminalize personal possession. So it would lessen the charges of personal possession, which would be 25 milligrams.
Representative Watson?
Would this become a, administrable drug that you have to get with a prescription, or something you could buy from any dispensary?
Right, so in my bill, you would have to go through the Psilocybin-Assisted Therapy Review Board, and therefore your case would be reviewed by this board to make sure that this is the correct treatment for you and it's not going to be used inappropriately. And then you would be able to have assisted therapy with a medical professional.
Representative Burke?
How much would this cost? I'm sorry.
Yeah, no. The U.S. Department of Health and Human Services will allocate $400 million of its $2.93 trillion budget to psilocybin-assisted therapy programs, and that would just be taken from other state programs.
Representative LeBron?
Correct me if I'm wrong, but psilocybin is it's a psychedelic, right?
Yes.
So would that not cause, has that caused issues with the past of you have a worker taking on it, or someone who's been prescribed to take it, but they have to still go and drive? Would the psychedelic side effect of this drug have any problems with, driving or safe operation of anything?
No, because you would only be taking the psilocybin when you are in that therapy room with the medical professional. It's not something that's going to be administered to you at home.